Sagittal section of the head, showing the nasal cavity and some part of the oral cavity, and then the pharynx and the larynx. First, here we have the frontal sinus, the paranasal sinuses. This is the frontal sinus, and here we have the sphenoid sinus. The nasal cavity is all lined with mucus except this area called the vestibule. This is the vestibule. This is the only area that's not lined with mucus. All the other areas are lined with mucus. You see this shiny surface? It's that mucus. And here we have the superior concha. This is the superior concha. This is the middle concha. And this is the inferior concha. Below each, there's a meatus by their name. Superior concha, below it is the superior meatus. Here we have inferior meatus. And again, this is the middle meatus. And here we have inferior meatus. On the uppermost wall of the nasal cavity, here we have the sphenoethmoidal recess. Sphenoethmoidal recess. It receives the opening of the sphenoid sinus. So the sphenoid sinus opens into the nasal cavity from here. Sphenoethmoidal recess. Here we have the olfactory mucosa for the olfactory nerves, first cranial nerve for the smell sensation. Olfactory mucosa. Here we said this is the superior meatus. It's for the opening of the posterior ethmoidal air cells. Posterior ethmoidal air cells, or posterior ethmoidal sinus. In the middle meatus, we have this area called the semilunar hiatus, or hiatus semilunaris. Anteriorly, it's called the infundibulum, that receives the frontonasal duct that drains the frontal sinus to the nasal cavity, basically. And here, at the posteriorly, the maxillary sinus drains to the floor of the semilunar hiatus. Okay, and this area superiorly of the semilunar hiatus is called the bulla ethmoidalis. It receives the anterior and middle ethmoidal air cells. In the inferior meatus, we only have the opening for the nasolacrimal duct. This is the opening for nasolacrimal duct. This is just for the screw, this is nothing. This is nasolacrimal duct. So this was the nasal cavity. Here we have the posterior nares or coini of the nasal cavity opening into the pharynx. Here, starting the pharynx. The pharynx starts from the base of the scalp. This is the base of the scalp from the C1, the atlas, until here, I guess C6. The names, this is the nasopharynx. Here is nasopharynx. We have oropharynx. This is the oral cavity, so this is the oropharynx. And we have laryngopharynx, because this is the larynx. Laryngopharynx. And then becomes the esophagus. In the nasopharynx, we have some areas. Here, it receives the opening for the auditory tube. This is opening for the auditory tube, or the classically called Eustachian tube. Opening for the auditory tube. Above it, we have an elevation. This is called the tubal elevation. This is the tubal elevation. The tubal elevation descends down, becoming salpingopharyngeal fold. So this is the salpingopharyngeal fold. Salpingopharyngeal fold. We have a tonsil related to here. It's called the tubular tonsil. Okay, so we said this was the tubal elevation, descending downwards, becoming the salpingopharyngeal fold. Underlying this structure is the salpingopharyngeus muscle, but this is called the salpingopharyngeal fold. Okay, we have some lymphoid tissue here. It's not shown. It's called the tubal tonsils. Maybe they must be related to here. Tubal tonsils. Behind it, we have the pharyngeal recess. This is the pharyngeal recess. On the uppermost aspect of the nasopharynx, we have the pharyngeal tonsils. This is the pharyngeal tonsils. When they enlarge, they are called adenoids. This is the pharyngeal tonsils. So that's all about the nasopharynx. Here we come to the oral cavity. Let's get oriented. This is the hard palate. The hard palate is formed by the by the palatine process of the maxilla and the horizontal process of the palatine bone, horizontal plate of the palatine bone. This is the hard palate, and then we have the soft palate. This is the oral cavity. This is the tongue. It is composed of intrinsic and extrinsic muscles. The intrinsic muscles, two of them are here. We have the longitudinal muscles. These are the longitudinal muscles. And we have the vertical muscles. These are the vertical ones. And the transverse one go like this. It's not shown here. Transverse is like that. Okay. This was the intrinsic muscles. The extrinsic, we only see the genioglossus muscle. This is the genioglossus muscle. Genioglossus. Under it, we have these two muscles. They are not muscles of the tongue. We have mylohyoid, from the mental spine to the hyoid bone. This is mylohyoid. This is geniohyoid. Mylohyoid and geniohyoid. These two are not muscle of the tongue. This is the anterior two-thirds of the tongue. We can see this is the anterior two-thirds of the tongue. The common sensation is from the lingual nerve, from the lingual nerve, from the hypoglossal nerve, the 12th cranial nerve. But the taste sensation is from the chorda tympani, facial nerve. The posterior one-third, the sensation and and the taste sensation, all of it are by the glossopharyngeal nerve, by the 9th cranial nerve, the posterior one-third. Behind it, we have the lingual tonsils. This structure is the lingual tonsil. Lingual tonsil. This is the epiglottis. This structure is the epiglottis. Between the lingual tonsil and the epiglottis, we have the valleculae. This is the valleculae. On this medial aspect, we have the median epiglottic fold. This is the median epiglottic fold. Okay, so the valleculae and medial epiglottic fold. On the oropharynx, we have just before the oropharynx. Here, it's not shown, but it must be here. The palatoglossal fold, and then the palatopharyngeal fold. Between the palatoglossal fold and the palatopharyngeal fold, there's the tonsil. The tonsil called the palatine tonsil. Between the palatoglossal fold and the palatopharyngeal fold, called the palatine tonsil. Coming downwards, this is the laryngeal inlet. This is the larynx in the front, and from the back it becomes the esophagus. I guess this is the sixth vertebral column. I guess C2, C3, 4, 5, 6. So this C6 larynx starts to form. So this we already said that this is the epiglottis or epiglottic cartilage. All right, and here I guess this is the aryepiglottic fold. This is the laryngeal inlet. This is esophagus, you know. This is the laryngeal inlet. Here's the larynx, and for here you have, this is the vestibular fold. The one above is the vestibular fold, also called, I believe this is the false vocal cord, and below is the true vocal cord. It's called a vocal cord. This area between them is called laryngeal sinus. Okay, this is laryngeal sinus, and this muscle is vocalis. This muscle is vocalis. And if you have the two sides of the two vocal cord, you know, it forms this shape. The area between the two folds is called rima glottidis. You know, this vocal cord and this vocal cord. This area is called rima glottidis. And we have some ligaments by the insertion and origin. We have a ligament from the hyoid to the epiglottis, so we call it hyoepiglottic ligament. Hyoepiglottic ligament, from hyoid to the thyrohyoid ligament. This is thyroid cartilage. This is cricoid cartilage. And here we have the trachea. So here, this is called the cricothyroid membrane or ligament. Cricotracheal